Access Fort Wayne offers reflections of our community. Production facilities provided by Access Fort Wayne are a service of the Allen County Public Library. The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting organizations. For more information about creating your own television program with Access Fort Wayne, call 421-1250.
Hello, and welcome to our show, The American Veteran. I'm Dale Parrish, your host, Carl Fowler is co-host, and our guest today is Brian Lamm. Brian is a 20-year veteran of the Air Force, and he's also now he is the DEKALB Veteran Service Officer. Welcome to our show, Brian.
Thank you very much. It's always a pleasure to come out and do these kinds of events. The biggest problem we have with veterans and services available to them is educating the public. Well, we've got too many veterans out there that do not realize that benefits are available through them through Department of Veterans Affairs. It's our job as service officers to not only inform them of what's available, but also help them follow the paperwork.
But how do they know you're there?
We have published websites at Indiana Department of Veterans Affairs. Most counties have a county website. We're listed in the phone books. Individuals like myself, we do outreach on a regular basis. I go to the American Legions, the VFWs, the DAV meetings, the AMVET meetings, and we try to approach veterans through those organizations. But as you're aware, there's a lot of veterans who's not members of those organizations, so reaching out to the public becomes an issue. And so I have taken them on myself. I go to the Lions Club meetings, I go to church functions, I go to any civic organization that'll let me speak, to try to get the word out that these veterans programs are available, not just for recently released, but there's a lot of programs specifically tailored to our Korean and World War II veterans that are not very well publicized.
Yeah. I know a lot of veterans they're not interested in joining the Legion or
Exactly. Some of them got the misinformation out. Many years ago, it was a place to go have a drink and some camaraderie and stuff. Most of the American Legions, VFWs, and things now are more family-oriented. They want to bring you in. They want to have functions available for the kids, especially since Indiana enacted the anti-smoking laws. Now we can bring the children into those facilities. There's programs available for them. You go to many of the organizations, and they have programs specifically for the children. They have shooting events, they have fishing events, they have craft events, and these are just for the children that you can bring in to orient back into the camaraderie that we face when we are in the military with comradeship, those individuals who's been there and done that.
Yeah, that's what we push at the Korean War Veterans Association, is the camaraderie and not to forget the ones that didn't come home.
Exactly.
Well, I'm glad you're getting out there to the public, because here locally in Fort Wayne, we've lost lots of our legions, and the ones that are still active aren't necessarily affluent.
Exactly. And that's part of it. It's training. It's training. Governor Pence signed a law into Indiana here 2 years ago. They required all county veteran service officers to become accredited. Mm-hmm. Accreditation through the Department of Veterans Affairs comes with some additional training. And with that training, it teaches our county service officers across the state how to become better service officers. It gives us a better understanding of what VA benefits are available so that we can in turn go out and educate those veterans. In most cases, if you remember back to when you got out of service, there was some crusty old sergeant at the exit facility that told you don't qualify for nothing, go home. Right. And that's where 90% of the guys fell into. Or there was another crusty old sergeant that says, yeah, you can file for VA benefits, but you're going to have to stay here an extra 2 weeks. And most of the guys didn't want to do either one.
Yeah.
Right.
So as such, they've come home, and they didn't really know that there's any VA benefits available.
Yeah.
I can tell you through experience, I've been doing this, I think about 12 years with the VA, and I can count the number of people that I could not get benefits for on my fingers. The vast majority of all veterans who have ever served qualifies for something.
Yeah.
It's just knowing what's available to qualify them.
Yeah.
Yeah. Some of the advantages to being a service officer is I get emails on a regular basis. The VA is no different than any other federal agency. Every single week they're changing the rules. And unless you're doing this on a frequent and regular basis, it's impossible to keep up with those changes. And so we've got veterans out there who are trying to file claims on their own, who are trying to muddle through the system on their own, and they don't realize that there is a quicker, easier, and better way to accomplish that by going to see the county veteran service officer.
Yeah.
Here in the state of Indiana, every single county except Marion County, Indianapolis, has a county veteran service officer.
Marion don't?
Nope. Indianapolis has chosen, or Marion County has chosen not to have a veteran service officer now.
Well,
those individuals are forced to either go to Indiana Department of Veterans Affairs where they can get assistance, or go down to the VA directly at the federal building for help with their claims.
Oh.
But we have a population of veteran service officers across the state that has changed dramatically in the last year and a half, partially because some individuals were older and did not want to go through the training required for accreditation. Other individuals, they had retired and they just didn't want to mess with it. So the group that we have got now are very, very, very dedicated service officers, very knowledgeable service officers. There's legislation in the works in Indianapolis to even enhance that even more. One thing that I would like to see is I would like to see every service officer in the state of Indiana be employed on a full-time basis by the county. I'm full-time. Cameron Lochner here in Fort Wayne, he's a full-time veteran service officer. But when you look across the state as a whole, the majority of the positions are only 1 to 3 days a week, and it's generally only 3 or 4 days. The state of Indiana ranked number 47 in the United States as far as getting benefits for our veterans. Number 47. That's almost the bottom of the list.
Yeah.
This initiative and the training approved by Governor Pence has allowed us to get accredited, get more training, those things. He's also approved the funding of a program called VetRespect, which ties all of the veterans together into a computer database, which is great. Those of us who are accredited, the Department of Veterans Affairs now lets us access VA records within the SEP, the Stakeholders Enterprise program, which allows us to look at the VA computer to see where a veteran's at, what the status of his claim is, his dependents, his finances, those kinds of issues within the VA computer, which is enhancing our ability to serve the veterans.
Well, sure. A guy comes to you, then you got a little background on him. And
Exactly.
You can help him. You know what he needs.
Exactly. The VA can compensate you. The VA is divided actually on my side of the house into two separate organizations, really. Compensation and pension. Okay. Compensation is funds that the VA can provide to an individual based on a current disability that we can provide a nexus or a link back to something that happened in service.
Yeah.
The VA can compensate you for any medical condition that began in service or a pre-existing condition that the time in service made worse. So there's a whole gamut of things that we can go back and look at. I generally want to pull their records out of St. Louis and go through their military, medical, and personnel files so I can see if they were diagnosed with a condition, what conditions they came into service with, to see if we can file a VA claim. Another thing we look at is presumptive conditions. You know, a lot of guys, you hear about presumptive conditions with the Vietnam vets and Agent Orange and all of that stuff. Mm-hmm. A lot of people don't realize that the U.S. government started using herbicides to defoliate in 1941. And so you may be a World War II vet, but if I can put you where we was using that defoliant, you get the exact same benefits as the Vietnam guys. You know, and so there's a whole lot of advantages to going and seeing a county service officer because we do this every day. And as such, we are privy to information that you as an individual veteran don't know. You don't know what you can claim, what the presumptions are. And so we can sit down, go through your documentation, and I always listen to war stories. I want to know where you was at, what you was doing, and not only do I get educated about, what really happened on in World War II or Korea or Vietnam or Bosnia or Herzegovina, these guys telling me their stories educates me, but it also allows me in that little interview process to determine what benefits are available to the individual veterans.
Yeah.
They vary, right?
They vary. Every single person that walks in the door is going to have a different story. He's going to be exposed to different things. And so you got one guy who comes in, he was a tank driver. He had 30 cows, twins sitting up on top. He had a 4-inch gun. He's going to have a hearing loss.
Oh, yeah.
No doubt in my mind. If he's working on a flight line somewhere, he's going to have a hearing loss. That's the nexus. That job is the nexus back to claiming that hearing loss is a service-connected disability.
Yeah.
When we get to the VA hospital, there's a lot of people out here struggling because of the Affordable Care Act, finding funding. Well, the Department of Veterans Affairs VA medical centers actually work for the Affordable Care Act in, effective health care. And so those individuals do not have to go back out onto the market and purchase health care insurance if they're enrolled at the VA hospital. There's several different ways we can get them enrolled at the VA hospital. If you was exposed to, say, defoliant Agent Orange or something, that's a gimme. We've got to take them in. If you were exposed to nuclear radiation, ionized radiation, then they automatic. If you was a POW, then you're automatically in there. If you're a Purple Heart recipient, you're automatically authorized VA health care. The second way is if you have a VA rating, disability rating at 10% or higher, then they're authorized VA health care. And then the third way is through means testing. Right here in this Fort Wayne area in this Northeast Indiana block, we're looking at about $40,000 a year, and that's gross income minus medical expenses, has to be less than about $40,000 a year to enroll in the VA hospital as a married couple. Or if you're a single guy, it's about $32,000, $33,000 a year. So if you're within those parameters, then we can get you in through means testing. But regardless of how I get you into the VA hospital, I still want to sit down with you as an individual and go through your record, what you did in service, where you was at, what you was exposed to, and do what I can to find a service-connected disability to compensate you for your service.
Wasn't there a lot of records burned?
That's just what
Yes.
I was going to ask you.
Exactly.
Exactly what it is.
What did you do in that
Unfortunately,
case?
St. Louis had a huge fire over there that wiped out a lot of records. And a lot of people think, well, since those records are gone, then there's no way to do it. Fortunately for us, if you remember the onion skin papers they used to pull off at the hospital records themselves were stored in a different place than the personnel records. And so the hospital records themselves were not destroyed. So you as a veteran can come into my office, and if you had your appendix taken out, you had, your wife hit you in the head with a frying pan, something where you had to go to the doctor or the hospital, or you went in for your annual physicals, if we can narrow that down to a short period of time, we can have the Department of Veterans Affairs and the National Personnel Records Center go back and review those hospital records and look for you as an individual and rebuild that record based on medical treatment. And so we can still find documentation within the system to prove our case to the VA for service-connected claims using those hospital records. We can also use ship logs and daily reports that those guys in the field were routinely filing back with DC. The Department of Veterans Affairs has access to those records. They can go back to Washington, D.C. to those archives and have individuals even look through classified documents. Now, the Department of the Defense is not going to release those classified documents and information back to the VA or anybody else. But we have individuals at Washington, D.C. that will go through those classified records and verify, yes, he was here. They won't tell you what he was doing. They won't tell you what was going on in the project, but they can validate that, yes, he was here and he was exposed. And so that's another basis we can use for a claim.
I didn't know you dug that deep.
Oh, yeah. Yes, indeed. We can go very, very deep, to find records to support the veteran's claim. all too often, a veteran thinks just because he got out of service, he don't qualify for anything, so he goes home and he struggles. We find that a lot with a lot of the World War II veterans now and the Korean War veterans. The other side of our house, not compensation, but is a VA pension program. It's for non-service connected medical conditions. If you find yourself unable to work because of a medical condition, then for a veteran who has a wife, say, he can have up to about a little over $2,000 a month to help him cover medical expenses. Say you and your wife wanted to move into an assisted living place that's got nursing care. Then through this pension program, we take your gross income minus medical expenses, and as long as they have a nurse on staff and they're providing you with medical assistance at that assisted living, then I can give you $2,000 a month to help pay for you living at that assisted living place. Same thing works if you are wanting to go into a nursing home. I can give you that pension program. It's called Aid in Attendance, to go into the nursing home and help pay those bills. But most people don't want to go to an assisted living. Most people don't want to go to a nursing home. The VA understands that veterans want to stay home as long as possible.
Right.
You can still use those same funds to hire a CNA or a caregiver to come into your home to take care of you, and you don't have to go to a nursing home. You don't have to go to an assisted living. You can stay home and use those aid and attendance funds and hire anybody you like to come in and help out. It makes a huge difference. What a lot of people don't realize is that's available to widows too. We've got a lot of widows out here who are struggling because Dad passed away, and in this area up here we had a lot of farmers. So Mom might be getting $600 or $700 or $800 a month total to try to live on. Well, that's impossible, especially if she needs help around the house. Our widow's pension, I think it's about $1,157 a month that we can help with Mom's needs, and it works the same way. We take gross income minus medical expenses, and then they have to fall below certain limits. It's a little over $8,000 if she just don't have any money for gross income minus medical expenses. That's what's left over. It runs up to just over $10,000 a year for homebound status, and then the aid and attendance runs just over $13,000. So there's different caveats there. The same 3 caveats work for our veterans too, whether they're single or married. The numbers are a little higher, the amount of money the VA pays them under the pension program. But we've got a pension program for a veteran who's just poor, and it runs out at about $10,000 a year. If he's homebound, it runs up to about $12,000, and then if he's married, then it runs into it's $20,000 and change. So we can look at those specific numbers, and based on what we have for deductions, we can probably, if you're very low income, we can probably get you some kind of assistance coming in the form of monetary compensation or a pension program for a non-service connected condition that is precluding you from working out there. The state of Indiana also has a lot of benefits that a lot of people don't know about. If you were in the military during a wartime period one day, then we have a program called remission of fees in the state of Indiana. That means all of your kids get 4 years of college on IDVA's nickel, as long as you have a 10% or higher VA rating. That is no age limit on that up through June of last year, when the legislature changed the rules a little bit for the new kids. Whereas I'll pay 100% of all tuition and fees for those children of disabled vets prior to June of last year. Starting June of last year on, we will pay 20% plus whatever their VA rating is towards their college. So if you've got a 20% VA rating, then the state puts a 20%, so we'll pay 40% of your kids' college for you, tuition and fees. They can go to IU, Purdue, Vincennes, Ivy Tech, Western Governors University. It doesn't matter, at any of the satellite locations. It's a great benefit available for them.
Yes, it is. That sounds like a...
Exactly. And, it's simple things. It's like the compensations. When we look at compensation for individuals, that 10% means a huge thing when you go to the VA, because you can get eyeglasses. Your hearing loss. Okay, hearing aids now The ones that the VAs are getting is about $6,800 a set. You know, most people who are on a fixed tight income can't afford that $6,800.
Right.
If I can get you a service-connected disability rating for bilateral hearing or hearing loss, then the VA will give you those hearing aids at no cost and provide you with the batteries at no cost.
Yeah.
You know, you know, a lot of guys, they worry about their spouses too. You know, we have those widows' pensions I was just mentioning for those widows of the veterans after they pass away who are on real tight budgets. But we've also got another program called DIC, Dependent Indemnity Care. If you have a service-connected medical condition and you pass away, and that's one of the primary, tertiary, secondary causes of your death, then the spouse is entitled to DIC. Well, DIC right now is running about $12.57, I think it is, per month.
DIC.
Dependent Indemnity Care,
Okay.
DIC. If you die of a service-connected condition, then the spouse, the surviving spouse and or children are authorized in this DIC. In addition to the $12.57 a month, they also qualify for a program called CHAMP VA, which is, it's like TRICARE in the military retirees. It's a medical program. She'll get a CHAMP VA card. She can use her private physician as long as he'll accept CHAMP VA insurance. And it's very small co-pays, and there's no annual fees to it. In addition to that, as long as they use meds by mail, there's no co-pays at all for their medication.
Great.
They just mail them the medication. There's so many programs available. We could sit here for 5 or 6 or 7 hours to go through the list of
All the
benefits
programs.
authorized. Exactly. It's just on and on and on. Education benefits. You know, we've got Chapter 35 benefits. Those individuals who are coming out that are severely disabled. It doesn't matter whether they're 18 years old when they come out of service or whether we got Korean or World War II guys now. Once you hit that magic 100%, education benefits for your spouse and minor children are approved at the VA under Chapter 35. Chapter 35 pays somewhere in the neighborhood of about $1,200 around here per month to send your spouse back to school, because she is now, because you're 100% service connected and disabled, she becomes the primary breadwinner of the house. So the VA has stepped up and said that we're going to train her to fill that role. You know? If you've got minor children, and say that you're 100% disabled and you've got a kid that's 16 or 17 or 18 or 20 or 21, that you cannot pay for their college because you're disabled, you had to quit work, your income is much lower, but it's because of a service-connected disability, then they qualify for the Chapter 35 too. And so as such, then they get that $1,200 a month while they're going to school.
Okay.
Now, one of the unique things that we have here in the state of Indiana is you can combine those two education benefits, the remission of fees, with the Chapter 35. So under the remission of fees, as long as you've got the 1 day of active duty service during a wartime period, you qualify for the remission of fees, which pays for all tuition and fees at the state universities. Then we can apply with federal VA for the Chapter 35 benefits to $1,200. Now that child has the ability to pull that $1,200 a month in to pay for books, pay for the dormitory, pay for the meal card, living expenses there at the college where he wants to go. So the VA is going above and beyond trying to do things to take care of these individuals.
Yeah. We've been talking about the male veterans. Same thing pertains to the female veterans.
Oh yeah, female veterans, and if you look at female veterans, there is a couple of other benefits that's available to them. We have a new Women Veterans Coordinator in Indianapolis. IDVA, you can go to their website, and there's a link there to the Women's Veterans Coordinator. Their phone number is 800-400-4520. You can access the Women's Veterans Coordinator there. And she runs programs specifically targeted for female veterans. The VA healthcare systems has specific departments that are targeting women veterans as far as medical care goes. A lot of people don't realize that if the women were exposed to the nuclear radiation or to the Agent Orange or the Agent White or Blue or any of the other compounds, in some cases, any birth defects in their children can be compensated to and taken care of by VA medical. Right now there really isn't any exposure to Agent Orange or anything in men that they have linked to birth defects in children, but those are available to the women. We've got specific women's clinics that take care of women's issues that men don't have to worry about. Yeah. We got a new program we started here in Indianapolis last year. There's an entire department at IDVA now in Indianapolis that goes out into the communities all over the whole state and targets those companies who want to hire veterans. And so if you're a veteran who needs a job, you can call IDVA, ask for the employment coordinator, and that employment coordinator can hook you up with a website and log in that allows you to look at those companies across the state have already signed up on board to provide employment opportunities to veterans throughout the state of Indiana.
Okay. I'm thinking of the veterans out there maybe that don't qualify for VA assistance.
Which part of it, or any of it?
Well, there used to be what they called a classification 8.
Yeah, and those classifications are still there. Classification 8 means that you're above the means levels.
Yeah.
And from what I've been told, that began because there people with a lot of money in their pocket taking advantage of the system, and so the director at the time implemented this category 1 through 8C. If we can't get them in through means testing, and that's where your 8Cs come in, it means you're over the thresholds. Mm-hmm. That's why I want them to come and see one of our county service officers across the state, because that individual can look for another way to take advantage of enrollment at VA through compensation. If we get him rated at 10% or higher, if we get that individual a pension, either one of those two categories then qualifies him for VA medical care.
Okay.
In addition to that, say that you was working last year, and enrollment in VA healthcare is based on last year's income, not this year's income. Say you had a good job, man, you was busting it out, you was making $75,000, $80,000, $100,000 last year. All of a sudden, you got to work. You ain't got no money coming in, or you had to take an $8 an hour job or $10 an hour job. We have 1010HS forms. It's hardships. Means that something significantly changed within your finances. And so we can complete that document, and based on current information, have you enrolled in VA healthcare. Because we often find that with individuals who are unemployed for any long period of time, that unemployment takes away your ability to be enrolled in a healthcare program at home. Brian, or at work.
Can you close it up here real quick?
Oh, yes, I can. I would encourage everybody who is a veteran. I can tell you that 99.9% of you qualify for some kind of benefits through the Department of Veterans Affairs. Go see the county service officer in your county, and let them, with their expertise, go through your records and determine what you're eligible for. My number has been flashed up here a couple of times. If you cannot find your county service officer, feel free to call my office. I am president of the Indiana Veteran Service Officer Association, and I have direct access to all of the veteran service officers. I can get you that information pretty quick.
Brian, will you come back for another show?
Absolutely. Anytime you'll have me.
All right.
Thank you.
Thank you very much. Appreciated your talk.
Thank you. I hope you enjoyed the show and got something out of it. I'm sure you did. Remember, freedom is not free. You see a veteran or someone in uniform, just walk up to them, shake their hand, and say, thank you for your service. Thank you, and good night.